Sleep apnea is something that occurs in actually a very large percentage of the population. It's mostly undiagnosed, but it is something that when people are awake, there are muscles in the throat that keep the airway wide open so you don't stop breathing when you're walking around and working. But when you go to sleep, the muscles that keep the airway wide open become limp. And as those muscles become limp, the airway and the throat collapses to some degree. And to some degree, this is normal. But in some people that have certain maybe anatomical predispositions, let's say a big neck or large tonsils or a retruded large jaw, the airway collapse becomes more significant. And it can happen to the point, as with sleep apnea, where the patient will actually stop breathing for periods of time during the night. And if you stop breathing for 10 seconds or longer, that's called an apneic event. So if that happens more than a certain number of times per hour, then the sleep apnea is graded on either mild, moderate, or severe. We have some patients who stop breathing more than 100 times an hour. And so what happens when that occurs, your brain's not getting oxygen to the cells, the whole body's not getting oxygen. And then when you briefly awaken, and it's usually not a conscious awakening, it's what they call an arousal, the brain will say to the rest of the body, hey, I need to breathe. And so it will actually waken you from your deep levels of sleep. You're not awake so that you're conscious or can talk or hear, but you're awake enough where your throat muscles will engage and open up that airway again. So if that happens 10, 20, 30, 40, and like I say, we see sometimes over 100 times an hour where this occurs, you can imagine that the patient wakes up in the morning and is about as tired as they were when they went to bed at night. If you've ever held your breath for 20 or 30 seconds or longer, you'll realize that your heart starts beating faster because now the blood has less oxygen. The heart has to pump the blood through its blood vessels much more quickly to get the less and less level of oxygen in there around the body to keep it alive. And this strain on the cardiovascular system, the heart and the blood vessels, is why people with untreated sleep apnea have about a 5-fold increase in dying during their sleep from either a heart attack or a stroke. So it can be a very serious medical issue.